Let's dive into what a trigger point is. Imagine a trigger point as a tiny, tightly wound knot in a muscle, like a kink in a garden hose that disrupts the flow of water. Except here, it disrupts normal muscle function. These points occur when muscle fibers or the surrounding fascia become overstressed, which can happen due to acute trauma, repetitive strain, poor posture, or prolonged tension. On a microscopic level, a trigger point forms when a part of the muscle stays contracted, causing an energy crisis from excessive calcium release. This leads to restricted blood flow, reduced oxygen supply, and a buildup of waste product, making the area hypertensive and painful. Trigger points can feel like small, hard nodules or taut bands within the muscle that are tender to the touch. And pressing on them often produces pain locally or even in different parts of the body that we call referred pain. For instance, a trigger point in the upper trapezius might feel like a persistent tension headache. There are 3 types of trigger points, including active ones that cause pain even at rest, latent points that only hurt when pressed, and lastly, satellite points that develop in muscles within the referred pain zone of another primary trigger point. To effectively treat trigger points, start by understanding the anatomy of the muscle involved. Knowing the origin, insertion, and function of the muscle helps you accurately locate potential trigger points. With this knowledge, begin palpating the muscle with your fingers, gently exploring the tissue to feel a taut bands or nodules that stand out. Think of it like searching for a small, dense pebble in soft sand. Once you find a suspicious nodule, confirm it's a trigger point by applying direct pressure and observing your client's response. True trigger points will produce localized pain or referred pain in different areas. For instance, pressing on a trigger point in the infraspinatus might send pain down the arm, closely mimicking shoulder or arm pain. Pay close attention to your client's feedback, asking if the sensation is familiar or similar to their usual symptoms, as this will help you confirm the presence of a trigger point. Now, let's talk treatment. There are several techniques you can use to help relieve trigger points. Static compression involves applying sustained pressure directly on the point with your thumb, fingers, or suitable tool, holding it for minimum 20 to 60 seconds. This temporarily reduces blood flow to the area, and upon release, fresh blood rushes in, helping flush out waste products. Another approach is deep tissue massage or stripping, using slow, deep strokes along the length of the muscle fibers, much like ironing out a wrinkle to smooth out the tension. Stretching is also effective, using passive or active movements to lengthen the muscle fibers and reset the muscle so its normal resting length. You can also use the pin and stretch technique, which involves pressing the trigger point while gently stretching the muscle by moving the client's limb, combining compression and muscle lengthening. Keep in mind that improvement may take multiple sessions, as trigger points often need consistent attention to fully resolve. Keep the lines of communication open with your client, using a pain scale from 0 to 10 to ensure they stay within the manageable discomfort range, ideally between 4 and 7. And provide self-care tips using tennis balls or foam rollers to manage trigger points between sessions. Thank you so much for watching. If you have any questions whatsoever, drop them in the comments. I'd love to help. Don't forget to subscribe if you learned something, or give that like button load to Popman for me. Anyways, much love, peace out, stay cool, adios.